Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Erysipelas, Hair Loss, and Osteoarthritis with 40 plus years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jimmy Chang, a widely known figure in the TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Synergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. For our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day, late afternoon, for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Okay, well, it's me again, Jimmy Chen. Today, don't move. We'll be talking about the erysipelas hair. Come on, don't move. Hair loss and osteoporosis. I mean, arthritis. Well, how come the pages keep on moving? Okay. Huh? It's all called. Never mind. Thank you. Okay. Still moving. Yeah. Okay. We'll be talking about 3 categories as erysipelas. Yeah, it's fine. Hair loss and osteoarthritis. It's very commonly seen problems. I'm sure you will encounter this kind of problem every day in your clinic. And today I'm going to share some of my really interesting understanding and treatment experience about those. Seems to be difficult cases. So first thing that we know, we should tell the patient's constitutional condition is like by their prescriptions or by their appearance. We don't do treatment according to Western doctor to their diagnosis. We have our own diagnosis system and we do our own evaluation. We do not give formulas or treatment following the Western diagnosis. That's the most important things a lot of people don't understand. They always tell you, my family doctor told me that I have something. Would you just please give me some Chinese medicine for that? It's not like that. We should do things according to their body type. That's so simple, the body type. For example, strong guys, skinny guys. Okay. This strong guy, this a little bit chubby and skinny. They all have their constitutional condition inside their body. That we have to put into consideration. And when we start using the herbs, that's a very important factor. Do not follow the terms that Western medicine has made. We do our own system. That's the point, one of the points of my seminar for so many years. Okay, qi deficiency, yang deficiency, or damp heat, or whatever. We have to make our own mind, and we do our treatment plan according to those conclusions. That's very, very important. Huh? Look at that. What's this? The treatment methods of different body constitutions are absolutely not the same. Even these two guys being diagnosed with the same problem, hair loss, osteoarthritis, the treatment will be totally different. I'm very sure about this conclusion because I'm doing this all day long for 50 years or something by their body type. For example, this little girl has a joint pain, maybe this elderly lady has joint pain, this big guy has joint pain, this young, strong guy has joint pain, the treatment will be totally different. It shouldn't be too difficult to understand, right? And this is our Bagua Mai. Bagua Mai, you should, when you take the pulse, strong, 3 level. So strong then is something to do with the head and colon. So by doing this combination, then you can tell what's wrong in their body. But those things do not show you the arthritis or hair loss or something, but it shows you the head and the middle and the lower jaw, the condition. For example, of course, like this, all strong. That means the head and the colon. The head means a lot of heat or fire in the head, and the deep pulse is very strong. That means there's some inflammation or joint pain in the lower limbs. For this condition, this upper part is head. Upper jaw is weak, and the lower jaw is weak too. So in this condition, we might use some, even this two guy has the same symptoms, joint pain or hair loss. The treatment will be totally different because this is the head, this is the solid, this is the weak. Even they are all losing hairs, we do not do the same treatment. That's the basic concept. And we do I do it all day long with the blood pressure readings. If it's high and diastolic is high and heartbeat rate is 85 high, then there's definitely heat, excessive heat. So something maybe in his head or in his whole body. And in this case, no matter what, we do not use 十全大补. So simple. The type 2 body type. Look at that. Systolic is low, diastolic low, 90s, and heartbeat rate low is definitely deficient cold. So in this case, no matter what, you can give him some 十全大补 or 四逆汤 for push the circulation to his joint. If this guy, young guy, even is young and strong, but if his condition is like this, we need something. If his demand was to treat his arthritis, and we still have used something like 十全大补 or something. Never mind the outside appearance only. We should take care of their condition by this blood pressure and heartbeat rate. Okay, sorry about the interruption. We're gonna do something interesting today. I was talking about this this Bagua view. 八卦 pulse can show you the body condition. In this case, the head is very high, painful or something. The lower part is weak. In this case, the head is empty and the lower part is weak too. And this one is solid. That means some inflammation in the lower part, the leg, knee joints or ankles or feet or whatever. So the treatment for those same diagnosis by Western doctor, but the body type different and the treatment will be different. So please bear this in your mind. I'm looking at this all the time in my clinic. Oh, because your head is, I'll say, your head is empty. Oh, in this case, your head is so swollen. You got a headache or something. Always right. Huh? Oh, we were talking about systolic. So the weak, this type is definitely weak. Then we can use 四拳大补. We cannot, even this guy or this lady has the problem with the knee joint swelling or a lot of inflammation, apparently inflammation, we still might use something to push the circulation like 十拳大补 or 补中医, not 补中医, or 四逆汤, something like that. Huh? It's a boot. Okay. And in this case, high is 140, not 75, and heart rate is low. It's not on blood pressure blocker or something. That's the sense of deficiency, excess heat or cold. No, either. It's dead blood, stagnation. The push is slow. So maybe when you do cupping, it might appear like this, the blood stagnation. In this case, I don't know if you guys do cupping or not. I do not do it in my office because I don't have enough time. But if you do this, they can directly show your patient, hey, I told you you have dead blood in your body, and this is the proof. Nobody can deny that, right? And this is the tongue. This is very easy. And type 4, systolic low. Mm-hmm. 90 and 60 and heart rate is high. This is the typical yin deficiency. That means nutrition, protein, blood, hormone are all deficient. So we do something, deficient heat. We cannot use too much blood mover, painkillers, things like that. We have to tonify her blood. I like to use 人参养荣汤, or then don't use 十全大补 because it's already very hot. Or use something mild like 人参养荣汤, 龟皮汤, something like that. And this, it's a reminder, this is the hormone pulse. We've been talking about many times. I'm sure you are all aware of that. This is very important for energy and for mood, for hair loss, and even for arthritis, but not for the Erysipelas. Not for that infection. This is no good. Okay, let's do. Okay, let's get on to business. This is the first topic we're going to talk about today. It's an acute bacterial skin infection. Affects the upper layer of the skin, the face, or anything.